Hello, I'm Christine Talley, an associate professor at the University of Minnesota School of Nursing. I am a co-investigator on the study I am presenting and want to acknowledge our interdisciplinary team from the University of Minnesota and our community experts from Male Care, led by our principal investigator, Simon Roser. This study was funded by the National Cancer Institute, and I have no conflicts of interest to disclose. Despite being the second most common form of cancer in gay and bisexual men, they remain a hidden population in prostate cancer care and research. Little is known about potential disparities in their cancer journey, with a particular deficit in survivorship issues. Gay and bisexual men frequently indicate that prostate cancer treatments and interactions with cancer care professionals do not address their specific needs as a sexual minority group. A common problem after prostate cancer treatment is persistent urinary incontinence that impacts quality of life. Emerging literature suggests that gay and bisexual men may report greater problems with urinary dysfunction following prostate cancer treatment. Therefore, our team designed a first-of-its-kind study to test a prostate cancer rehabilitation program designed specifically for gay and bisexual men. RESTORE is an ongoing two-arm randomized controlled trial testing the efficacy of an online rehabilitation program designed exclusively for gay and bisexual prostate cancer survivors. It is a multi-component intervention targeting urinary and sexual dysfunction. Participants select which components they want to address. Components to treat urinary incontinence include pelvic floor muscle exercises, and participants could select different treatments for sexual dysfunction. I will not be discussing the sexual health outcomes in this presentation. This presentation will present one-year outcomes related to urinary incontinence. The aims of this analysis are to describe change in the severity of urinary incontinence over 1 year for RESTORE participants, to determine if participating in the RESTORE intervention improved urinary incontinence over 1 year, and to identify subgroups that might have more severe incontinence or be more likely to respond to treatment. "401 participants were randomized to either the treatment or control group and included in the intent to treat analysis at 1-year follow-up. Participant attrition was low, with only 11% of participants discontinuing the study over 1 year. Recruitment and data collection occurred online. The primary outcome measure of urinary incontinence severity was measured with the short form of the International Consultation on Incontinence questionnaire. The FACT-G measured cancer-related quality of life, and several investigator-designed measures were used to assess demographic, health, and prostate cancer characteristics. Longitudinal data analysis was conducted using linear mixed effect regression models in Stata software. The RESTORE participants had a mean age of 63.5 years. On average, participants had received prostate cancer treatment 5.3 years ago. The most common type of cancer treatment was surgery, followed by radiation only and combination therapy. Only 3% of participants indicated having no urinary incontinence during the study. In AIM 1, we described change in ICIQ scores for all participants. The unconditional model demonstrates that baseline ICIQ values varied significantly, meaning that participants had a wide range of incontinence severity at the beginning of the study. However, there was no change in ICIQ scores over 1 year. The predicted ICIQ scores for each time period ranged from 6.2 to 6.8, indicating little change. In AIM 2, we identified that participating in the intervention group did not improve urinary incontinence over 1 year. This is evident by the linear time coefficient p-value being 0.696. However, participants in the control group had greater severity of urinary incontinence at baseline, as you can see in the top line, that persisted throughout the study. In AIM-3, we did not find any subgroup that responded to treatment. However, there were predictors of having greater urinary incontinence severity. Participants with obesity and worse health-related quality of life had significantly higher ICIQ scores at the beginning of the study and 1 year later. The same pattern appeared for participants who did more pelvic floor muscle exercises, indicating those with more severe incontinence selected to do the pelvic floor muscle exercises, but still did not see a treatment effect. In regards to the type of urinary incontinence, men with mixed incontinence reported the highest degree of severity with urinary incontinence, followed by men with stress incontinence, insensible incontinence, urge incontinence, and then post-void incontinence. In conclusion, participating in the Restore Rehabilitation Program for gay and bisexual prostate cancer survivors did not change incontinence severity over 1 year, and no subgroup of participants emerged as having benefited more. The multi-component design of Restore reflects real-life practice. Participants selected which components they wanted to address, and those with more severe incontinence did in fact select to do the pelvic floor muscle exercises. However, they did not see an improvement in incontinence. It may be that the dose was too low or that adherence was decreased by the stresses encountered by participants during the COVID pandemic. Given the different types of incontinence experienced by participants, future interventions need to include more than just pelvic floor muscle exercises. Additionally, these long-term survivors with persistent incontinence symptoms may need more intense or different treatments.